Hey, welcome back in. It is 8:20 in the morning as we continue Breast Cancer Awareness Month. Today we're taking a look at the importance of mammograms, how they really work, how important they are to our health. And Dr. Talia Gates is an OB/GYN at Walker Baptist Medical Center, and she joins us this morning to talk about this. Good morning.
Good morning, Janice.
Well, we all know what mammograms are, but still, so many people still don't have their yearly mammogram, do they?
It's true. It's true. People think they're uncomfortable, think they don't really show any benefit. There's lots of different reasons. And there's been lots of different confusion lately about, healthcare changing recommendations. But, basically it's just gotten more lenient on what you can do. But at the end of the day, it still is recommended that you start your yearly mammogram at 40 and get them every year.
Okay, so and the insurance is still paying for them yearly?
Insurance is still paying for them yearly.
And obviously if you have any history,
correct,
it would be even different, wouldn't it?
Right. You need to get with your doctor, whether it's your primary care doctor or an OB/GYN. You need to have a yearly exam with somebody and talk to them every year. They will go over your breast health and your breast risks, whether that's things you've been exposed to in your life or whether it's your family history, and adjust those recommendations based on your personal history. But if you have no other risk factors, the recommendation is still to start at 40 and to have a yearly mammogram every year. And not just a yearly mammogram, but a yearly clinical breast exam by somebody who's qualified to examine your breasts.
Okay, so I know that, like you said, women may be scared of them. Sometimes we're scared of what they'll find.
That's the truth.
And I know many women watching probably had the same thing. I had a spot one time. They took a biopsy. It ended up being nothing. And that's what it is a lot of the times, right?
Yes, it is. Most of the time, it's nothing. But the reason you do it yearly is so, and it's just like our faces. Every women's breasts are different, then they show up different on a mammogram. So we need a baseline to follow every year. So if we see those subtle changes, then we can address them and look at them. And again, most of the time it's nothing. But if you've been consistent with your yearly mammogram, there is a slight change. Even if it is something, hopefully you catch it much sooner.
I know there's been kind of up and down debate too about self-breast exams.
Right.
They've said they don't really need to do those. Why would you even say don't do those?
I know, it's so silly, but health is all based on these huge, massive studies. But if you're the one person that found your breast lump and it made you, catch the cancer sooner, then it's worth it, right? So what we say now is this is self-breast awareness is what they recommend now. So just be aware of what your own breasts feel like, as funny as that is to say.
If there's something abnormal, like you would anywhere.
Yep, exactly.
If you felt a knot anywhere.
Yeah, if you saw a mole on your face that you may want your dermatologist, same thing. Exactly same thing.
And they're not the most comfortable things in the world.
I have not had one, but that's what I hear.
You need to have one just to see.
I know, just to see, I know.
But they're not. But they obviously, that few minutes of uncomfortableness outweighs anything that it may find.
Absolutely worth it, and we've gotten, technology is constantly evolving. Something else that's being, that's sort of a buzzword in healthcare lately is dense breast tissue, and people get scared. What does that mean? I have dense breasts.
Right.
All that means is that your mammograms may not be quite as sensitive, and so you and your doctor, based on your clinical breast exam, decide if you need further imaging other than just a regular mammogram.
And what would further imaging entail?
Ultrasounds. There's actually some digital mammography now.
Okay.
There's one where they actually combine the X-ray with the ultrasound to kind of have a 3D breast view. And technology is constantly evolving and changing, but again, that would be an individual decision with your doctor.
I'm thinking if we can see 3D imaging of a baby, you can see the 3D imaging of that as well. All right, so as we wrap up, just your recommendation, anyone watching right now, if you've not had a breast exam, what do you need to do?
You need to see your doctor every year, and at 21, your doctor will start both pap smears and clinical breast exams every year. It's very important. And then based on your family history, recommend when you need to start mammograms at a minimum of age 40, and get them every year.
All right, good advice. Dr. Gates, good to see you.
You too, thank you.